This is a AP internal rotation radiograph of the right shoulder in a 21-year-old female presenting with shoulder pain. Looking at this radiograph alone, we don't see any definite evidence of acute fracture or dislocation at the glenohumeral joint. However, upon close inspection of the acromioclavicular joint, we notice that the AC interval is widened. If we were to measure this distance here between the distal clavicle and the acromion, it would measure about 8 or 9 millimeters. This is clearly widened. It's greater than 6 millimeters, and this is consistent with a grade 2 injury of the acromioclavicular joint or grade 2 separation of the acromioclavicular joint. Notice that this is not a grade 3 injury because the corticoclavicular distance measures less than 14 millimeters in this case, and there's no superior displacement of the clavicle as we would expect to see in a grade 3 injury. So a grade 1 injury is an occult injury which we do not see on radiography where there is simply sprain of the acromioclavicular ligament. Grade 2 injury represents a tear of the acromioclavicular ligament with widening at the AC joint greater than 6 millimeters, and grade 3 injury is manifested as a tear not only in the acromioclavicular ligament but also the corticoclavicular ligaments with widening at the corticoclavicular interval greater than 14 millimeters. Grade 2 injury is treated conservatively with rice, with rest, ice, and analgesics.